Can I have
Hello and welcome to all the viewers. Thank you so much for joining us in this Nutrition Nectar program on CANC. And if you're wondering what that is, it's Campaign Against Nutrition Quacks and Courses. It's an acronym. CANC, a voice against quackery in nutrition and dietetics practice. Today's guest on my show is Ms. Sheryl Salis and will be later joined by the CANC team. We'll tell you as we go along who they are. They will be joining us a little later. And as usual, if you have any questions, please type them in the chat box. A very warm welcome to you, Sheryl. Thank you so much for sparing your time and coming here to educate people about who or what is a qualified dietitian. I think that's very, very important.
Thank you so much, ma'am, for the invitation. It's my pleasure and honor to be here.
Thank you. Before we move forward, I would like to share my screen and show the disclaimer. Please give me a minute. Are you able to see this?
Yes, ma'am.
Okay, great. The views expressed in this program are for information only, with no intent to harm or offend any individual or group or company or institution or organization. Nutrition Nectar or its founder cum host or founder's family cannot be held responsible for the views expressed by others. Please seek a physician's help if you have a medical problem, and please consult a qualified dietitian for personalized diet plans. I'm going to stop sharing now. And so we move further to introducing Sheryl, today's guest. I think it was last week, Sheryl, when you or your team posted, on Instagram that CANC had completed 3 years, right? And yes, I said, this is a great time to call the CANC team and especially you onto Nutrition Nectar, because you people are doing such great work. So I thought this would be the perfect time, since you completed 3 years, and 3 years is a long time to go, especially when you're doing voluntary work and all of you are working so hard. So that's how I reached out to you, and you very readily agreed. So thank you once again for that. And I'm going to introduce you now to the viewers. Sheryl Salis is a registered dietitian, certified diabetes educator, certified insulin pump trainer, and author of the books Diet in Diabetes Simplified, Your Personal Diabetes Nutrition Coach, and Nutrition Basics and Carbohydrate Counting. She is the founder of Nurture Health Solutions and CANC, for the fraternity, by the fraternity. I like that. With a career spanning 21 years, she has rich experience in the field of nutrition and metabolic disorders, and in the past has worked with leading hospitals and multinational organizations like Johnson & Johnson and Novo Nordisk. She is committed to the cause of working for children with type 1 diabetes and has managed over 2,000 children with type 1 diabetes in her career span. That's excellent. Her book on nutrition basics and carbohydrate counting is referred to globally by experts and patients. She was selected among 15 healthcare professionals in the world by the International Society for Pediatric and Adolescent Diabetes at Boston in the US in 2019 for special training in research in type 1 diabetes. Congratulations on that achievement, Sheryl. That's excellent. She has been invited as a speaker at many national and international medical conferences and public forums. She has been actively involved in academics, being associated as a course director, visiting faculty, and a research guide to various educational institutions. She has co-authored the Purple Book, that is from the FSSAI, and has authored the Family Guide for Mumbai in collaboration with the Municipal Corporation of Greater Mumbai. She also features as an expert nutritionist on television and in the print media. She has done food shows on television like Health Mange More, Health Magazine, and Tiffin Box for the Food channel. That's a long list of achievements, Sheryl. And once again, congratulations for all the good work that you're doing. I can see a lot of people saying good evening, wishing all of us. Thank you so much. Beena Chadda, Madhu Sharma, Kushbu Agarwal, Geeta Malhotra, Lubna, Preeti Rahul. Thank you all so much for being here on this program. All right, shall we begin with the questions?
Sure, ma'am. Thank you so much. It's really, as I said, it's our privilege and honor. And you've always been very supportive about this initiative. And we started it 3 years ago. And I mean, it's been a long journey, but it's been a very enriching experience, I must say.
Oh, that's wonderful. So we'll hear more about it now, going further in the discussion, right? Let me begin by asking you, what made you start CANQ?
Ma'am, we've been hearing and we interact with a lot of patients, and every day, we wake up to WhatsApp messages asking us, is this true? Some WhatsApp forward that a friend, family, or a patient would have received. And it's, information that has been spread by some self-proclaimed expert or, a quack. And most of our time, even in clinic or even otherwise, is spent answering these, queries. And people believe them, more than us, because they say good things, which are good to hear. And even if it doesn't work, people feel that, whatever they speak makes sense because they have a very a good PR machinery, as well as, they spend a lot of money on PR. And they're very good, they've got the gift of the gab. So they speak very well and very convincingly. And two things that happened within a span of 1 week was one of my type 1 patients was misguided and landed up in the ICU. Very, very, I would say low socioeconomic family, and landing up in the ICU with diabetes ketoacidosis because they, were advised by some quack to go off insulin and go on some kind of a diet, which is not even a diet which children should follow. Giving up on food and just going on raw juices and salads, and the parents were giving the child that, and then the child without insulin, we know that type 1 children cannot survive, and that happened. And then there was another instance that a friend's friend succumbed because of drinking bottle gourd juice, which was bitter, and bottle gourd juice when bitter can be poisonous, again as directed by somebody who was not qualified. And that's when I thought, I should do something about it. And all the, my friends and colleagues from the fraternity will agree with me that I've been talking about it and voicing out that we should do something about it. But then we had our own limitations. So we said, I said, okay, let me start something, using social media and, in some way where I could reach to more people and at least clarify these myths and misconceptions. And that's how it started. I'm telling you, it wasn't a Sunday afternoon. And usually my weekends are very busy because I'm always speaking at some conference or some, or the other. And that weekend I had no work. I didn't have a conference. I was sitting in the afternoon, I remember doing, and, this was playing on my mind. And I said, okay, let me start, do something. And that's when it started. So it was one Sunday afternoon in June.
Oh,
and that's how CANQ was born.
That's very interesting, Sheryl. And thank God for that idle Sunday afternoon where you didn't have any invitations. That turned into something very big and, something wonderful, I think. That's excellent. Now, moving on to the second question, how did you build the team in CANQ? I must say this here before you answer, that today we see a lot of, people who would like their names and photos pasted everywhere, whether they're contributing anything or not, but they would like it to be pasted everywhere, on every social media platform or everywhere, practically everywhere. But in this kind of a, selfish, so to speak, world, I see that you and your team are almost anonymous. And you don't, you don't put your names, you don't put your photographs, nothing anywhere. And you work, what should I say, in the background all the time. And you work in the name of CANQ. And you work so selflessly. Really, how did you manage to come across such a beautiful team? And how do you all do this, all of you?
So, ma'am, honestly, on that Sunday afternoon, I said, I'll reach out to my friends and, I mean, from the fraternity. So I did reach out to quite a few of them. And I was very clear that I wanted it to be an all India initiative so that everyone can contribute and we become, stronger as a fraternity. And I reached out to friends from all over India. And a few friends, they came forward and, I've got a few friends whom I know for a very, very long time now, like Geeta and I were colleagues at Holy Family 20 years ago, and we still managed, we still remained very close friends. Veena has been a very old friend. Tejinder was somebody I knew. I knew Rita ma'am always fell for the cause. We've always discussed about it. And then Preeti Rahul is a good friend of mine. And I wanted to reach out to people also who, would help me, in the social media thing, because that's very important. They should be creative. They should be able to make posts. And we reached out to quite a few people. Some people said, yes, we are with you. We'll support you from outside. Some people were willing to be a part of the team. And that's how the team came into existence, and all like-minded people. And my one thing was that, I wanted to be absolutely where we don't have our names. It shouldn't, like, no post will have our name or our photographs, because we have our individual pages for that. We want to promote ourselves. We have our individual pages.
Absolutely.
So this has to be absolutely like a voluntary, selfless activity where we are doing it. And honestly, ma'am, it is not even for us, because, all of us, whether we are academicians or dietitians, clinical dietitians practicing, some of them are practicing in hospitals, some of them, some of us have our own individual practices, and we are very well established in our own field. And we have enough patients. So honestly, it wasn't for us, but I thought that this was important for the future generation, because they are going to face the brunt, and social media is now becoming a big thing. First, at our time, it wasn't such a big thing. People still came to a qualified person. Today, because people are using Instagram and Twitter and a lot of other social media platforms, there is more access to these quacks. These quacks also get more access to people. And that's why we also should use social media as a platform to come forward and, educate the masses. So it was mostly done to educate the masses. And that was my prerequisite, that this is definitely not for self-promotion. And we had a few people who came in the beginning who were not very comfortable, not being able to put their name on a post. But we were very clear that, and thankfully, this team has really stuck. We're 3 years now together, and we are on the same wavelength, which is great.
That's excellent, I think. A lot more people are saying hello to you, Sheryl. We have Devarupa Bhattacharji, Swarupa Kakani, Tejendra Sarna, Vinny Joglekar, Vijita, Minu Thomas, Swati Chandrasekhar, Reema Rao. Wow, I mean, it's amazing. Thank you so much, all of you, for being here. Rita Patil has just said hello. Thank you so much, really. We really appreciate your support and for your presence this evening here. Okay, moving on to the next question.
I'll just share a few slides, if
yes,
with your permission.
Yes, absolutely.
So I'll just show them the team. So, everybody gets to see the team.
Yeah, that's really nice.
So this is the disclaimer.
Sorry, can you go back to the first slide, please?
Yes,
yeah. So this is what CANC stands for those of you who don't know. Yeah.
So it's Campaign Against Nutrition Quacks and Courses.
Right.
And this is the disclaimer.
Sure.
So CANC was founded in June 2018. I just told you how it came into existence. And the main aim was to make people aware of unrecognized nutrition courses and quacks, and basically to try and disseminate evidence-based scientific information to the masses using different media. And like I mentioned, we work selflessly and not for personal publicity, and total commitment towards the cause of weeding off quacks. I know we can't do it by ourselves, but at least an attempt, and to spread awareness till the government comes out with the Allied Healthcare Council comes into existence. At least till then, we try and create awareness. And this is our team. So we have one person from Gujarat who's very dynamic, and she's fabulous. And Swati is, and Swati and I were very close as friends also right from the beginning. So when I approached her, she came, she said, yes, I'm there to support you. And the others were all from Mumbai. So though people think it's from Mumbai, but it's definitely having a pan-India, presence.
Okay, that's wonderful. All right. So do you get alerts from your followers or healthcare professionals? I know you have a huge, fan following on your CANC pages, social media pages. So do you get alerts from them or any healthcare professionals? or does your team trace the quackery on its own?
Ma'am, all the time. Our messenger is beeping all the time. WhatsApp, I'm always getting messages. And, even on emails or like our Facebook Messenger, we've got so many messages that keep coming where, from the fraternity and doctors. I have so many doctor friends now who know that you're working for this cause. And even if they come across something, I'll get a picture, saying that, I thought we should alert you. Sometimes they cross-check with us. Like right now, because of the COVID pandemic, there's so many people, making videos and, giving advice. And some of the doctors, if they're not convinced, they will actually send me that video and say, what do you think? Is this right? Is this person qualified? And sometimes I tell them, yes, this is a qualified dietitian who's speaking,
Oh, that's
so now,
so nice.
Yeah, it's wonderful. So in fact, ma'am, I want to tell you, sometimes when I go for conferences, I have young dietitians who come forward. I don't even know them, but they come and tell me that their parents wait, every morning to see what CANQ is posting. And that is wonderful.
That's such a compliment.
Yeah, it's, I mean, you sometimes, because you're working, but we really don't know that what's happening, what is the kind of effect this is having, unless somebody comes and tells us. In fact, every morning when we post, now we've like spaced out the post, but there is one person, actually none of us know in the team, but every morning he'll be the first person to like the post and comment saying thank you. And that is huge motivation. I mean, all of us working selflessly, with our given work that we're doing through the day. Sometimes we spend the night, we're actually doing our post in the night, discussing. And, this small things gives us a lot. It's very gratifying. Yeah, and it only motivates us more.
I'm sure. So how does CANQ process the information received about an unqualified person, making, sometimes grand statements, sometimes attention-catching statements? Can you share, the process?
Before that, I'll just tell you about us. I mean, we are now 12,000. So basically no promotion. We've not boosted any posts, no money paid, nothing. We've got close to 12,000 organic followers. And if you see the reach, I've just put it up over here that, we have people from all over the world who follow us. And it's wonderful. We've got people from Sri Lanka write to us sometimes, from Bangladesh. So we've got followers from all over. And even they are experiencing the same problem. We sometimes think it's only in India, but actually it's a universal thing. And we have a page which is very similar to CANQ called the Build Up Dietitians. In fact, they also follow us and they do quota posts sometimes, they do. And that's really nice because they're an international organization doing similar work. And we have quite a few reach. And again, I think this qualified dietitians, what I've really noticed and what everybody would agree with me is that now every dietitian, whether she's speaking at a conference or she's doing a webinar or she's speaking to patients, addressing people, she does mention a qualified dietitian. So I think that, has really come out very, very strongly. And I think somewhere we would like to take credit for that we started making the noise, but today people got more confidence. And now people know that there is this whole body, we are very united as a fraternity. And now we can do it and we'll get support.
Oh, that's wonderful.
Yeah. And we've as I said, doctors, we've got certain patients. We've got a lot of patients also, people who follow our page. And now, sometimes doctors actually write to me, they will send me a forward and they'll say, Sheryl, if you can make a reply to this, because then I can go and share it with my patients. And I'll show you some of the posts that, we've been able to do. And, some celebrities, but very clearly we don't take names because we don't want to call names, that we are very careful about. So no name taking, nothing. We're just trying to spread awareness. So we don't want to bring anybody down, but we just want to work together to bring the fraternity up.
I think that's, I'm very glad you brought this point up, Sheryl. In fact, I would request the viewers here also, please do not, if you think somebody, according to you, is unqualified or a quack or whatever, please do not mention names either in this chat box or anywhere else. As Sheryl said, and I completely agree, that we need to bring our fraternity up rather than put somebody else down. I think that's very important.
Yes.
So, all right, before we move on again, hello to Amuta, Anand Kumar, Bhumika Singh, Munaza, Indu Vaishnavi, Susan Varghese, Preeti Rahul again. And Amuta says, great initiative and congratulations on this venture. Thank you so much on Sheryl's behalf. And Susan Varghese says, amazing, what an ideal Sunday afternoon created. Very well said,
I actually don't know what to do on the weekend if I'm free, ma'am. That's what my husband says. He's like, you really don't know how to chill. And I'm like, I don't know. I'm so used to working and it's nice, and this is really gratifying. And thank you to everybody who's joined in. They've all been huge supporters. I mean, whether it's, Rima and everybody, they've been huge supporters.
I'm sure.
Again, so sorry, ma'am, I was answering that question of yours.
Yeah. So what steps does CANC take to ensure that whether it's a video or any kind of post giving false information on diets, how do you ensure that it's corrected? I mean, if it is corrected at all?
Yeah. So, ma'am, one is that we like, I'll just show you a few. So one is to try and speak at whether it's a public forum or at conferences. I do speak about CANC and the work we do, and why it's important for doctors also to hire qualified dietitians. Right. So we tell them that, what are the credentials of a qualified dietitian, and, what should they look for? In case they have a challenge finding a qualified dietitian, they can reach out to us and we will direct them to a person in their area. So that way they can generate more jobs, as well as our qualified dietitians get the right position. So, I think today doctors are definitely, looking at, in fact, they reach out to us sometimes and ask whether is she qualified, she's from this college, is this recognized? And that's great. So we've got this thing called CANC ambassadors. So we actually reach out to the fraternity and tell them, we've reached out to doctors and we've asked them to make videos, which we post on our social media handles, where they can, speak about, one is about consulting a qualified dietitian, and certainly, sometimes dispelling certain myths. And a lot of them, in fact, Dr. Gankar, who's been my mentor and guide, he's no more, but he's been really supportive of the cause and he's been following us, following the page as well. We have a lot of our own fraternity people who've taken slides from us, whenever they've been presenting, whether it's at to patients or speaking on radio or at a conference. We've got some of them making YouTube videos, and they are talking about consulting a qualified dietitian. We tag them, so that gives them also the recognition, as well as we know that they're there supporting us and speaking for the fraternity.
Excellent. So are all these people in this photograph that you're showing dietitians?
Yes, ma'am, all of them. So Shimanti is from Kolkata. We have Charul from Nasik. We've got Anjum. We've got Nandita, who's again from Mumbai. And, they've reached out to us, and we've been supporting them, So they get some of their posts, they get it vetted from us, trying to check whether it's right. In fact, Shimanti and team in Kolkata are doing fabulous work because they are facing a lot of quackery there. Yeah, so they are our CANC ambassadors.
How nice.
A lot of them.
I like that CANC ambassadors nomenclature.
Yeah, and we tag them, so we tell them you post it and we will repost it. So that way they also get the, the due recognition for, for working for the cause. And I think it's really motivating. A lot of them feel really motivated, especially the junior dietitians, because they are facing the brunt. Honestly, a lot of them are. And I think this is helping them also, work for the cause.
Yeah, not just the juniors. I think even, those with experience can be bolder and talk about it. That's wonderful. All right, moving on. Have you seen any incorrect information or, let's say, false statements being retracted after CANC issues a corrective declaration? Because I see that you're issuing a lot of corrective information, right? So do these people who have posted the wrong information retract it?
Yes, ma'am. On multiple occasions, we've had people who've actually deleted the post or changed the post, and it's really, I mean, I can't take names, but we've had quite a few of these instances, and we actually put the facts out, so whether it's uric acid, because everybody says uric acid means top protein, but then we give them the right information, which is science backed, this about alkaline and ionized water. As I told you, it was from one of your sessions that you were doing with Dr. Nimali Singh in Rajasthan, and there were queries. And sometimes what happens is not everybody is very creative or can think, or knows how to make a post. So we are making these posts so that it's there on the CANC social media handle. You could share it. So, all you need to do is share. You may not have the time to make a post, or you don't know how to do it, but at least here we're making it. It's ready-made. You just have to share it on ketogenic diet or even coconut oil. In fact, we had Dr. Udupi also came forward and wrote an article on coconut oil, and it got a very, it was shared. It became viral, actually, that post.
Okay. So that's nice. I think, the way you actually give facts when you see wrong information being posted, I think that's a wonderful way of tackling it. All right. So does CANC have any guidelines on how to recognize a qualified dietitian?
Yes, ma'am.
Because there are so many out there, and one doesn't know who's qualified and who's not. So do you have anything to say?
Yes, ma'am. So this was a very interesting post on a batata vada. So actually it came from a doctor, and he's working for a corporate, and he said, Sheryl, can you just make a clarification post, on this? And then immediately we worked on it and we shared it with him, and he shared it with more than 1 lakh employees in his organization. So, that's the kind of impact this has, because they don't know, they want to cross check and they want to give out the facts, because even they are hounded with messages from their employees and patients. And that is what we, do. I think there was something on you can eat fruits and fruit doesn't increase sugar. So we had a, rebuttal on that as well. So it's all killing it with science. And I think this was a very recent thing, about one of the spiritual gurus who said that you don't need to be on insulin and for type 1 diabetes, and you can just control it with yoga and diet. And, we really made a big noise about it. And we had a lot of associations who actually issued letters and, notices, and even the NHS UK came forward. And again, this is because we really got united. The type 1 body got really united. And in fact, the type 1 associations also, they now forward our posts on their groups, So this has been really, really good.
Yeah.
This is very recent again. So a lot of things that, we give a lot of testimonials out. And ma'am, the one which is on qualified dietitians, I'll come to it.
Okay, sure.
So this is what it is. So we have this thing called identifying quacks, So, how do you identify quacks, and, what are some of the jargons that quacks use? And if you come across any of this, please ask for qualifications. And we actually ask people that, a qualified dietitian will never feel bad if you ask for qualification. She'll feel very happy about it. And today we've seen, in fact, we do get a lot of calls from, clients and patients who ask us, what is our qualification? Are we specialized to see maybe a cancer case or a renal case? And that's really very nice and gratifying again, because at least we know that they're following the CANQ page, and they know that how important it is to consult a qualified dietitian. So we have laid down certain things on our page. We've got videos also that are made, even about courses. So this is the specifications that we have put down on our page, that what are the specifications for a qualified dietitian. So even when you cross-check, make sure that she's got one of these degrees, which qualifies her to be a dietitian or a nutritionist.
All right. That's but this is India specific, I presume.
This is India specific, ma'am.
Okay. All right. That's interesting. So those of you who are watching this program, you know what or who is a qualified dietitian. I think CANQ has taken the effort to put it all out there, and it's very nicely made. Thank you so much for sharing that slide and that information. Okay, moving on to the next question. In spite of increasing awareness on qualified professional work versus quackery, there appears to be no end to unethical practice and unqualified advice. There are more and more such people and such advice mushrooming every day. And as you rightly said, especially during COVID times, there are a whole lot of messages going around. Some are genuine, of course. I'm not saying all of them are not, but some are genuine, but some of them are giving false information. So any suggestions on how to tackle this trend?
I think we just have to get stronger, more united, get together, keep spreading the right information. I think that's most important. And I think with the Allied Healthcare Council coming in, I'm sure that will be the best way to weed off quacks and quackery. So till then, I think we have to continue doing our job. Most important is, I think strength lies in unity, coming together. And absolutely. All of us can make a difference. I mean, just a few of us, we're just a few of us, and 8 people with full-time jobs becomes very, very difficult. So we need more hands and more ambassadors coming forward, and we're all there for the cause.
Yeah, that, that takes me back to the chat box. Someone said, let me just read it out. Yeah, Pooja Novel says, hi, ma'am, how can I become a part of this campaign? So Sheryl, do you want to have anything to say to that?
She can just write to us, maybe, go on our page and send us a message, and we'll be very happy.
Okay, that's
in fact, ma'am, I just wanted to show you this also. This is actually, you have large FB communities of women. And this has been something which has been extremely gratifying. So, on their page, anybody can just post, do a post, and you have to pay a small amount and you can promote yourself. So initially we had a lot of quacks promoting themselves on these pages, but we actually wrote to these people. And today they've made it like, mandatory that, they check the qualifications of the person. If they're claiming to be a nutritionist, they will check. They sometimes cross-check it with us. And yeah, so all these, if you look at Mumbai, Momo Moms, it's one of the largest FB communities in Mumbai. It's led by Neha Kare. And in fact, now I do a lot of work with them, and it's wonderful. So they've also now come out in support of us. And I think this has been a huge success for us, that we've managed to get these women, at least, we've made them aware, and now they don't allow any non-qualified person to post on their page.
Okay, that's fantastic, I think.
Yeah.
All right, moving on. Does the public reach out to CANQ for nutrition or dietary advice? And if they do, how does your team handle it? I mean, do you give professional advice yourselves, or do you direct the public to other qualified professionals?
Ma'am, it depends. Yes, they do reach out to us. So on Messenger, they would reach out, or on our post, they will message. And then we reach out to them. And then depending on which place, because now it's all virtual, but otherwise, whichever location they're from, then we'll direct them to that nutritionist, the dietitian. And depending again on the case, because I feel everybody is not a master of all, like I am maybe good at diabetes. There may be somebody who's good at cancer. So then I'll direct them to an onco dietitian, somebody who's good at renal. And we do refer them to a qualified dietitian.
Oh, that's wonderful. Before I ask you the last question, I'm just going to quickly say hello to a lot of others who have said hello to us here. Snigdha Shah, I love all the posts you send. That's excellent, Sheryl, that compliments you and your team, of course. Priyanka Singh, good initiative. Keep it up, she says. Jigna Janendra says, best wishes, dear Sheryl. Kudos, team CANQ. That's so nice. Again, a lot of compliments coming to you and the CANQ team, Sheryl. And I hope the rest of the CANQ team is listening. Dion De Silva, thank you for joining. Amatullah Kapsi, awesome initiative, Sheryl ma'am. Excellent daily posts on CANQ. Again, compliments to you and your team, Sheryl. Okay, I don't know what dieta, the way of life means, but this person says, great initiative taken. It's the need of the hour. Thank you. Aarti says, hello. And Leena, good work, Sheryl. Leena Padnekar says, good work, Sheryl. Swati Chandrasekhar says, great work, Sheryl. Kudos to you and your team. Safal Mahadik says, good initiative, Sheryl. It's the need of the hour. Huda Sheikh says, would like to help to spread awareness. Sheryl, you're getting a lot of supporters already.
That's great, ma'am. We need more people.
Yeah, wonderful. So Sanjana Sengupta says, 3 cheers for the CANQ team for this wonderful voice raised and for always inspiring us. There you go, Sheryl. You and your team are doing fantastic work. Palomi Desai says, great work. Kudos to the team. So those were all the compliments and
it's wonderful. It's really wonderful. I mean, it's the fraternity, actually. As I said, we are for the fraternity, by the fraternity, and that's the strength lies in that, ma'am.
Absolutely. And Indu Vaishnavi just said, really an inspiration. So Sheryl, and you and your team are not only inspiring everyone, spreading awareness, and also I think leading by example. That's wonderful. So I'm going to ask you one last question. Would you like to say anything else before we take the audience questions?
Sure, ma'am. I'll just run through a few more slides. And
all right, let me also take this opportunity to invite the rest of the CANQ team onto the Zoom, please. If all of you, if you're, I don't know if you're there listening to what we are saying, but if you are, please feel free to join on Zoom so the rest of the viewers can see all of you. Please start coming in. There's no waiting room. You can just click on the link and get in. Yeah, please continue, Sheryl.
Yeah, so ma'am, there was a course that was started by a qualified dietitian where she was, going to be training non-qualified people. And actually, we sought help from Madhu ma'am, and she really supported us because she was one of her interns. And then, she intervened, and that girl wrote us a mail saying that, no, I'm not going to run this course. And, I'm only going to run it for qualified people. And there's a lot. So we had the CANQ anthem. I'm sure you heard it. This was at Indore. And thanks to Preeti Shukla, she's really supportive. And we had our own, team, a lot of students who actually, Amatullah was one of them. And there was Shifa and Saili, all from my team. And beautiful, anthem on Quackery. It was really lovely. Okay. And we did this DP frame, which was for qualified dietitians. And there was a day when we actually put this frame out, the Facebook looked yellow. Everything was yellow because everybody had changed their DPs. And it was wonderful to see it. some of the media, we've had a lot of support from our dietitians. So whenever they're interviewed on media, so if you see Eileen had some interview, to the media, and she reached out to us and she did speak about it. In fact, she's been a youth supporter as well. And, in the media. And this was a very wonderful initiative. In fact, college had invited us to, and the students had made skits and on Quackery. And the people in the audience were their family members. And it was wonderful. And this was just before COVID happened. And it was really nice. The kind of creativity was like, wow. And so we had, this is something that we definitely want to pursue even post this pandemic and the lockdown. So that is nice, the CANQ outreach. We've got 5-star reviews, a lot of people from the fraternity itself. And this is extremely encouraging. And thanks to all of you for your support. This is, I think Holy Spirit did a beautiful video, Amatullah and team, and it was really nice, on educational again on Quackery. And it was really nice. And I, every time, like this was when you were speaking about qualified dietitian in Bangalore, and somebody sent me a picture saying that, ma'am mentioned CANQ, and I do get that. And it's so lovely. It really makes it so satisfying and so worthwhile. So it was really nice. And we really seek more support from the fraternity. And that's one is to create educational content, because, sometimes you're working for 3 years, you lose out on ideas. So we definitely need more fresh minds, more creativity, and volunteer, to go and conduct awareness programs in schools, colleges, in the neighborhood societies, etc. And at the most, I think, share our posts, because that's not something about us. It's about sharing, about CANQ and making more people aware. I think that's the only way that we can handle this. So these are our social media handles. And
oh, yes. Can you keep that page a little longer, the social media handles, so that people can take maybe a photograph of it in case they're interested.
And they can email us. If anybody's interested in contributing, please email us on cankindia@gmail.com.
That's easy to remember. Okay. Yeah, please move on.
And this is it. Thank you so much, ma'am.
Okay, wonderful. So will
I'll stop sharing.
Stop. Yes, please. Yeah. Will you please stop? Yes.
I think the entire team is there.
That's
and everyone's in
hello.
Good evening.
Hello, everybody. Before I say hello to all of you, let me say a quick hello, because you were already there in the audience and you came here. So I'm going to say a quick hello to Rohini, who says a great initiative, Sheryl. I'll come to the questions a little later. Okay, somebody else says, okay, this is a good platform, etc., etc. Somebody has also answered somebody's question here, I think, because Pooja says, can you share your page where I can message you to be a part of this campaign? And somebody has answered saying that check out the CANQ page in FB. I suppose that's right. Okay, somebody else says, okay, this is a good platform, etc., etc.
Can we hear a echo?
Yeah, I don't know.
Beena, can you mute yourself? You can hear an echo for some reason.
Yeah, I was trying to check. Yeah.
Okay, that's all right. All right. So great. Jyoti Deshmukh says great work by CANQ team. Compliments to all of you. And okay, so happy to see all the Wonder Women. So here are the Wonder Women. Now over to all the Wonder Women. Here, shall we start taking questions? Yeah, any of you can answer. I mean, it doesn't have to be Sheryl. So if there are any questions, please feel free to ask. I did see a couple of them. Just give me a minute, please. Okay. How do you find which are the authentic courses in the nutrition field and which ones are just quacks?
Maybe Rita ma'am can answer it. She's an academician, the best person to answer.
Yeah, so actually what we know that most of our nutrition courses are definitely well-designed programs of reputed universities and even autonomous colleges, which are reputed autonomous colleges. So now what has happened is there are many people who come forth and start an institute where they themselves are not qualified. All they do is appoint a few people and try to design a program. And what the problem over here is the entry, who is permitted to do these programs is a problem. We all know that studying nutrition, we need to study a little bit of chemistry, know a lot of chemistry, biochemistry, physiology. So if you take people from very other streams where they don't have the base for this, it is a problem. So our concern is that you at least develop a program and take the right people for it. Here, it's not the point that I'm charging so many fees, and if whoever pays me the fees, I'll give them the diploma. That is what we don't want. We want people who really will learn and will understand things and then maybe use it in practice.
Okay, that was very well explained, Rita. Thank you so much. I don't see any questions as yet, so I'm going to, first of all, a very warm welcome to the entire CANC team. Well, the entire team is not here, but whoever is here, I can see Rita, Tejinder, Veena, Geeta, and Veenu. Thank you so much for coming on this platform. Yeah, thank you so much, really.
Thank you, ma'am. Our pleasure.
Yeah, great. So can one, each one of you take turns and then share maybe a couple of thoughts with the viewers? Well, you can go in any order. It doesn't matter.
Benu must share how we met. Benu was somebody I didn't know at all. And we met thanks to CANC, and I'm so thankful to that, argument that we had.
Yes.
And
so
then she
good
became
evening.
a part of CANC.
Yes. Good evening, everyone. If I can very quickly add this little humorous event that had happened. So what had happened was, I think one of the very first few CANC posts was about, what is a qualified dietitian, listing out the entire qualifications. And I happened to just see that post. I wasn't part of CANC then. And I saw the post and I saw there was no mention of specification. So I am a postgraduate sports nutritionist, undergraduate dietetics, and a PG in sports nutritionist. And I didn't see sports nutrition being mentioned in that list. And I got very upset, because unfortunately, I don't know whether it's changed now. When I graduated way back in '94, we were not then allowed to give our RD exams as well, So there was a lot of feeling that, I couldn't even do my RD. And of course, very happy with wherever you are now. But when I saw that post, I got a little upset. And so I wrote on the post, and then I went one step further and I wrote another post. And then I went one step further and I wrote to IDA. And I did so many things just to and that entire post exploded completely. The next thing I know, Sheryl is sending me a message on Facebook Messenger, and we spoke and we fought. And we fought and we fought. But eventually, I think at the end of it, we both realized, and then I think everything was corrected. And then a few days later, we connected and she said, why don't you hop in? You seem to be somebody who's really wanting to do this and take this up. And yeah, so that's when I joined CANC and I met these wonderful people. And I think for me, I was out of the nutrition fraternity for a very long time because I got into more of the fitness side of it and continued my journey on nutrition on my own. So it's great to be back, to have made so many lovely friends, and to have found a family here. So that's how my association with CANC started, actually.
Wonderful. Who wants to go next?
Should I say?
Yes, please,
Geeta.
Firstly, good evening, everybody. I'm really excited and very happy today. Thank you very much, ma'am. The most important thing that, as Venu said, yes, we all 8 are like a very united family. The process of learning is wonderful. The other thing is that I think we are sensitizing people, the awareness that we are spreading. It makes you feel happy and it makes you feel satisfied at the end of the day that, you're giving back to society in some way or the other to help the masses. And especially now after the pandemic, we have realized that how sensitive is good health for everybody to know. And through this platform also, it's a very, very important platform wherein we are trying to tell the people who are the right people, catch hands, and who will take you through this journey very safely and make you a successful, not only health-wise, but otherwise also. So I really feel happy, and I'm very happy that Sheryl gave me this opportunity to be here and interact with everybody. Thank you.
Excellent. Thank you, Geeta. Who wants to go next?
I'll go next.
Yes, Tejinder.
Thank you, Sheila ma'am, for this opportunity, and big hug to Sheryl for uniting us all together, people from different streams, and we all people have a very different mindset, but when we are on team CANQC, we think align. And I have experienced this, that none of us, even if we are ill, even if we are in hospital, even if we are working, even if we are bed, taking our temperatures, we all are together making posts. So one post, we share one post that this is the idea, and then every one of us start working on it. So there are critical comments also, no, post it like this, mold it like this, frame a, you have to make a picture like this. So with these 8 minds, we work together, and this is all under Sheryl's leadership, able leadership, that we are all united together, we are working, and we will keep on working for ages with you, Sheryl.
Best part is there's no egos. Everybody's
Yeah.
feedback is taken, and it's all for the betterment. We want the post to be good. So everybody's inputs is very important. And we have senior people like Rita ma'am and all who tell us, okay, now you're going a little this, So we need that also. We definitely need people. Sometimes we get very over enthusiastic. So
and
thank you.
Sheila ma'am, I'll share that. Everybody had a COVID instance in their family, but the post never stopped. Some or the other way, everybody was working. Geeta was on hospital bed making posts, Beena with her mother working, Veenu with her parents and everybody in the family, Geeta ma'am, Sheryl, and all the 2 more members all had COVID patients at home, and everybody was there making posts. It was not like this that I cannot make posts for a few days. No, everybody is there, even for single second, even for single minute. We all are there. And it's for the fraternity, by the fraternity.
That's excellent. And that shows your dedication and, selfless work. Amazing, really. Hats off to all of you. All right, who wants to go next? Beena and Rita.
Yeah, Rita ma'am. Rita ma'am.
Spoke. You want me to tell you more? I will only tell you that the dedication that each one of them have, because I probably am, just giving a little bit of advice or correcting something, but the things that they do, like Tejinder said, even if there is a problem at home, not one day has the post not happened. And that is the commitment all these people have, who are really, wherever they are constantly thinking of how to lead this campaign ahead.
That's wonderful. Amazing, really. Beena, you want to go next?
Yes, ma'am. I'm the last one left. Ma'am, I still remember that Sunday wherein Sheryl, messaged me about the seed thought which had come in her mind, and we formed that group. And I'm telling you, when we were even, we were so excited about this talk again, and we were just thinking about it, all the 3 years memories just flashed in front of us. And like how everyone has said, we are one strong family. We are one strong family who will know, everything, at least, everyone. We may not think about our personal page. We may not think about our personal page, but CANQ is always there for us. Our post, our thinking will always be for CANQ. And, we've got such good support from everyone. We are really, really thankful to everyone. And Sheryl's leadership is just amazing. Just amazing. Really hats off.
That's wonderful. Thank you, Beena. That's awesome. Each one of you has said such wonderful words. I think all of you as a team are working beautifully together, and it's great to see this, the vibe and the chemistry in this group. And I think you're doing amazing work, and wish you the very best. And I hope really you can take it to greater heights. Now let's get back to the chat. There's one question. Susan Verghese asks, too many satisfied patients, would that be a red flag to nutrition quackery? That's a very interesting question. Would that be a red flag to nutrition quackery if there are too many satisfied patients?
In what way would she say that? Would it be satisfied patients from qualified dietitians?
No, I think what she's saying is if everybody, loves what, if all the patients are satisfied with whoever is advising them, would that mean that, the person who's advising them is a quack? Or I think that's what she means. This is what I understood from the question. Or could it be a qualified person?
I think that's very important is for them to check, like I said, ma'am, nowadays we do have, in fact, even we discuss, we get calls from clients asking us our qualifications, and, that's really gratifying. So I think we have to spread the message about, what is the qualification that a dietitian needs to have, for us to sell. Because today you have a lot of people who are starting a lot of nutrition ventures, while I think it's great, honestly, because it actually gives more opportunities to our dietitians. And when we started, I'm sure all of us at, 20, 30, 25 years back, the opportunities were so few. One interview and the whole class used to be there because there were no vacancies. Today, there's so much. But it's good. I think the only thing that we are not very happy about is that if you start a venture and you're not a nutritionist, you cannot call yourself a nutritionist. You have qualified dietitians, great, please do good work, but you cannot call yourself a dietitian.
So perhaps that kind of answers Susan's question. It could be a qualified dietitian. It could also be somebody who's not qualified and maybe is just giving all the advice that the patients want to hear, and therefore becomes very popular. It could be either ways, right? Okay, Chaya Mishra. Thank you for joining, Chaya. Her question is, people with arts and commerce background do certification course in nutrition and they become self-proclaimed nutritionists. Now, I don't know if this is a question or a statement, but would any of you like to comment on this?
This is exactly what I was saying earlier when I spoke. We want people who have the background or who have the knowledge to study further, and only certificate courses are not ideal for anybody. Yes, Venu, say.
So if I may add here, besides, since I belong to the fitness fraternity also, what we commonly, very, very commonly see there is a lot of enthusiasm amongst, people from the fitness fraternity to essentially add nutrition, that nutrition element to that, because then they become a complete package. And so a lot of fitness instructors do these short 3-month, 6-month courses, and then they want to start giving out diets and things like that, and then also want to start promoting a lot of whey protein supplements, this, that, and the other. So maybe that question related to the to the art science background, the non-science background is maybe a little bit related to that, because these are the people that are usually tempted. Because for most people, they think there is nothing major about writing a diet. What is there? There is nothing essentially. Why do I have to study so much? I mean, I have, like I said, because I belong to the fraternity, and a couple of times I was asked by a few organizations to help them out in setting up a program where the instructors would do that as a part of their fitness program, and then be able to write diet plans. So I think that is where maybe a little more work needs to be done to kind of maybe educate the instructors that you can maybe become an instructor by doing a 3-month course or a 6-month course, but you cannot become a dietitian, because that's where a lot of study and a lot of understanding of different aspects are required. So in fact, even if they're fitness trainers, I personally recommend them that they need to be working with doctors. They need to be working with orthopedics, because even as instructors, you will know just that much. Yeah. So maybe that's where a link could be to the question that was posted.
Okay, interesting. Great answers. Thank you so much.
I can just add here is that, that with the Allied Healthcare Council coming in, anyways, these people will be out. So I think till then, for sure, because that is, they've had their own criteria that who can be called a qualified dietitian. So I think we'll have to wait for that.
We'll have to wait and see what the Allied Health Professions Council will finally say. But meanwhile, I think you guys are doing a great job, so keep it up. And Ruchi Meena says, great initiative and efforts by CANC team. So once again, compliments to all of you, and congratulations. I don't see any more questions. So I guess we will end here. And thank you all once again for joining in, and keep up the great work. Congratulations on completing 3 years, and wish you all the very best for your future, both professional as well as for CANC.
Thank you so much. Keep blessing us and supporting us as always.
My pleasure. Thank you. And
thank you, ma'am.
Thank you, ma'am.
All of you. Yeah. Thank you.
And thank you to everyone who joined in. And, it's really motivated us. It's like, that doll which is being wound. I think now we we are wound and we will work harder because we know that the fraternity looks up to us, and we want everyone to come forward and help us, further the cause.
That's so nice. Thank you. And bye-bye.
Thank you so much. Bye-bye. Bye, everyone. Good evening.